Did you know that your skin might be whispering a message your doctor hasn't even heard yet? Especially for those over 60, there are subtle signs the body gives often overlooked, often dismissed that could point to something far more serious than aging or irritation. It might sound surprising, but persistent itching in very specific areas has been quietly connected to certain types of cancer, sometimes long before more obvious symptoms show up. This isn't about causing alarm, it's about tuning in. In today's video, we're going to explore 5 specific itchy areas on the body that could signal internal issues, including forms of cancer like lymphoma, pancreatic cancer, breast cancer, and more. You'll learn why these spots matter, what underlying conditions they're connected to, and how to recognize when it's time to dig deeper. Stay with me to the end, because this knowledge could empower you or someone you love to take early action that truly makes a difference. Let's begin. Sign 1. Itching on the front of the lower legs. It might seem harmless. You feel an itch on your shins or calves. Maybe you chalk it up to dry skin, maybe a new pair of socks. But if the itching becomes persistent, shows no rash, and doesn't respond to lotions or creams, it may be something more. Doctors have noticed a consistent pattern. This kind of leg itching, especially in older adults, has been linked to lymphoma and other blood-related cancers. It often worsens at night, and the skin can appear completely normal, even though the sensation is deep and maddening. Why does this happen? Cancers like Hodgkin's lymphoma affect the lymphatic system, releasing inflammatory chemicals that circulate through the blood. These chemicals can irritate nerve endings, particularly in the legs, causing an itch that seems to come from beneath the skin. So if you're constantly scratching your shins, not getting relief from moisturizers, and especially if you're feeling more tired than usual, experiencing night sweats or unexpected weight changes, don't just let it slide. Ask for blood work. The itch might be the first signal, not the last. Sign 2. Itching between the shoulder blades. Let's talk about that annoying itch right between the shoulder blades, the one you can't quite reach. Many people think it's from a tag, or maybe sleeping in a strange position. But when this itch lingers for weeks or months, and no lotion or scratching seems to help, it could point to something much deeper. In some cases, pancreatic cancer has been associated with this type of discomfort. Why? Because as tumors in the pancreas grow, they can block the bile ducts. This causes bile salts to build up in the blood, and one early result is itching in areas dense with nerve endings, like the upper back. The back is full of nerves, and sometimes internal stressors show up externally in the strangest ways. If you're feeling that deep itch and also noticing symptoms like fatigue, changes in your digestion, dark urine, or lighter-colored stools, it's time to speak up. Even if it seems minor now, your body might be trying to get your attention early before pain kicks in. Sign 3. Itchy scalp without flakes or redness. Next up, the scalp. An itchy scalp might sound like no big deal. Maybe it's the shampoo. Maybe it's the weather. But what if there's no dandruff, no redness, and the itch just won't go away? In some older adults, chronic scalp itching has been an early indicator of leukemia or even skin cancer developing under thinning hair. This type of itch is different. It feels tingly, crawling, or even burning. And it doesn't respond to dandruff treatments or moisturizing oils. Why does this happen? When leukemia begins, it can affect how the immune system regulates inflammation, irritating nerves across the skin. The scalp, full of nerve endings and often exposed to the sun, becomes an early target. If the itch moves from place to place on your head or stays stubbornly in one spot, and especially if it's accompanied by fatigue, frequent bruising, or just not right feeling, don't dismiss it. Get it checked. Sometimes the itch is your only warning light. Sign 4. Persistent itching on the chest or around the breast. When itching starts in the chest or breast area, it's easy to assume it's just friction from clothing, sweat, or a tight bra. But when that itch stays in the same place day after day, and nothing seems to ease it, it may be worth a closer look. For women and even men, inflammatory breast cancer or tumors growing close to the skin can begin with subtle signs like this. The skin might feel warm, a little tight or slightly rough, but there may be no lump or redness at all. In some cases, lymph nodes under the arm or near the collarbone can swell internally, causing discomfort long before anything can be seen or felt. It's easy to brush off this kind of irritation, but don't. Especially if you notice dimples in the skin, a change in nipple texture, or an itch that never seems to wander. Bring it to your doctor's attention. Early detection could make all the difference. Sign 5. Anal or genital itching that won't go away. Let's face it, this is a hard one to talk about. but it's important. Persistent itching in the genital or anal area is often blamed on hygiene, sweat, or even aging skin. But when it's chronic, one-sided, or starts to feel like a burning or raw sensation, it needs to be checked. Cancers of the vulva, anus, and even penis can begin with nothing more than a recurring itch. In older adults, especially women after menopause, vulvar cancer can hide behind symptoms that mimic dryness or irritation. But if the skin starts looking thinner, discolored, or the itch keeps returning, it's time for a professional exam. One key clue: if it doesn't respond to any creams or changes in soap, and you've ruled out common causes, don't delay. It's far better to ask and find nothing than to stay silent and miss something serious. Here's the bottom line: your body is constantly communicating. The key is to listen closely, especially as we age. Pain might not always be the first sign. In fact, sometimes it's just a subtle itch that won't quit. So let's recap the 5 areas to watch. 1. Lower legs, especially the shins. 2. Upper back, between the shoulder blades. 3. Scalp, without redness or dandruff. For chest or breast area, near the nipple. 5. Genital or anal region, especially when one-sided. These are not about panic, they're about paying attention. If any of these signs feel familiar to you or a loved one, don't ignore them. Bring it up. Get it checked. Start the conversation. Your instincts are wise, and your body deserves to be heard. Thank you for watching. If this video helped you, let us know by commenting below with the word aware, and be sure to subscribe for more insights rooted in wisdom, care, and proactive health. Take care of yourself, and remember, small signs matter.